Okay, so Dr. Vazquez and Dr. Rosa, it's a pleasure to meet with you and talk about grief therapy with Latinos. And one of the questions I had that's a more general question and maybe a more personal question, that is, why do you think there's a particular need for cultural competence when doing grief therapy with Latinos?
Well, first of all, there is hardly anything written on the subject. It is a difficult subject because it is a heavy subject. But for some reason, there is not as much information on the topic. Mm-hmm. So we felt that, first of all, our experience as supervisors, teachers, and clinicians, everyone deals with losses, different losses of the people you love, losses of your cultural background, values, and sometimes your own health. And we combine aspect of the relevant cultural and clinical components to then consolidate and research, whatever research is applicable to, mm-hmm. to combine in one place so that hopefully others will follow and expand in our work.
Okay, wonderful. And another element another question that I had, a more general question about this book and the way that it's approached, is do you employ a particular psychodynamic or multicultural model in this book, and what components of those models are incorporated in this book and in the kind of grief therapy that you discuss?
Yes, so we try to combine both of us. We're trained psychodynamically, but we're also very invested in the question of how to integrate aspects of culture into the work that we do. So we try to look into some components of both and see how can we apply this in the work with the Latino population. So from the psychodynamic perspective, we basically work with the attachment theory and the concept of what is the impact of a secure attachment versus an insecure attachment in the loss experience. And so we elaborate that. And also we also include the experience of immigration. So the separation and loss of immigration, also thinking from the lens of the attachment theory.
Okay.
So that's one. The second one concept was multi-states and in the self, which is the ability of an individual to hold two different experiences at the same time. And this research has been done to show that now individuals can develop an identity different in a setting and another one different in a setting and hold both. Mm-hmm. And we feel that if we think from the multicultural lens, which is somebody that has been in contact with two cultures and developed two identities, and part of that would create impact on how they deal with loss.
I see. Thank
and then,
you.
Carmen, would you like to talk from the multicultural perspective, what we adapted?
Well, we use the value system of the culture, and there are specific values such as that are key, such as familism, the importance of the family, or machismo, which I think everyone knows that it is. These are gender-specific way of expectations of behavior in men, and then the opposite is marianismo, which is another expectation that is specific on how women should behave, very relevant to a grief process, because that can sometimes present maybe even clashes, not only within the individual, but with the family, with friends, with the world, with the two different worlds that Dinelia was talking about within the individual. And so we base some of the values or the concept that we have used in this book also in a model called the tripartite model that was developed by Sue and Sue, and they have three different levels: the individual, the universal, and the group. We have taken number two, which is really the cultural component, which has been elaborated and featured well within our treatment modality, because this was not really designed for grief, but what we have done in this book is combine what is useful from the different theories that we have been either trained at or that we have been read about and followed the research that has been valuable, so that this book can be useful not only for psychodynamic clinicians but for social, behavioral, and other type of clinicians who are working with people who have had.
Okay, great. So then we've had here sort of an overview of the psychodynamic components and the multicultural components, but also you touched on the key cultural values that may play a role in a Latino's experience of grief that you were talking about, the
Yes.
amusement.